I'm from South Carolina. My parents are from South Carolina. My grandparents are from South Carolina. I grew up here in Charleston, and I left to go away to college at Duke, but then I came back here to medical school. And then after finishing medical school here, I went back to Duke to train in neurology and did a neurology fellowship there. Then I came back here on faculty, and I've been here on faculty ever since. I think my treatment philosophy has three parts. I think first, I try to get to know my patients as best I can, to try to understand what treatments they've had in the past, what they've experienced, the symptoms that they have, and try to understand as much as I can. And then I try to take that understanding of their past history and try to develop a treatment plan based on the best scientific evidence we have, based on research studies, some based on my own personal experience, but mainly based on the research done in the field. And then third, I try to be a good communicator. I think it's very important to communicate to patients what they have, what the prognosis is, and also to explain to them what the different treatment options are. I think the more patients understand about what different treatment options there are and the pros and cons to each, that I think that enables them to make good decisions. And I try to let patients make as many decisions as they can about their care. A big focus in my work here is epilepsy clinical trials, providing patients with other alternative medications that are not available in pharmacies that are part of research studies. These medications are new and we don't know as much about them, but they're brand new state-of-the-art medicines which are often very good, and we're able to provide patients those medicines years before they would get them in pharmacies. We've tried hard to develop a large and very well integrated team to manage patients with epilepsy. We have not only epilepsy physicians, but epilepsy center coordinators, epilepsy center nurses, and all of us work together to manage patients. We have a conference several times per month where we all get together and look over patients' histories, their imaging, their EEGs, to develop a comprehensive treatment plan for how we're going to manage an individual patient's case. We have NIH-funded EEG research, NIH-funded neuroimaging research, and we have, I think, a great set of different tools we can use to help find out what causes people's epilepsy and how to treat it.